7, 6. Good afternoon. This is Dr. John Bennett broadcasting from Miami Beach, home of neurosurgical TV. Today we have the pleasure of having well-known neuroanatomist Victor Hugo Perez Perez from Mexico City. He's going to give a presentation on spinal neuroanatomy. Before we start with Victor, let's go around and briefly introduce the panel. Hello, Assam. How are you?
Fine. This is Hussam. I'm a medical student at the Faculty of Medicine at the University of Hama from Syria. I hope to be a neurosurgeon in the future.
Welcome, Assam. It's important to know neuroanatomy. Okay, Mujahid, could you please introduce yourself again as well as your associate?
Yeah,
Got a little feedback there. You have to turn off the volume of one or the other.
yeah, okay.
Just the volume.
I'm Stan, neurosurgeon. Here with the program, and here in the hall we have Dr. Hunaida, senior resident in 5th year of residency, and we have Muaz Ibrahim. The camera cannot show him in 4th year of residency.
Okay.
And I think a lot of people will join us.
Okay, they'll be able to see the screen, correct? Will they be able to? They'll be able to see the screen?
Yeah.
Okay, good. Okay, Victor, it's all yours. Could you please introduce yourself and tell them what you do and your work before you start, Victor?
Yes. Can you see the
Yes, we can
screen?
see it. Yes. We can.
Okay. Wait, please.
Okay.
Okay. Okay. Can you see it?
Yes.
Okay. This is Dr. Victor Hugo Perez Perez from Mexico City. I have been working in Centro Médico Nacional in the Social Security of a Mexican Institute. So we are going to review the theme about vascularization of the spinal cord. This is a really interesting topic because I am very sure that you are going to see something that few people have seen, because this kind of research is, I think, very interesting. So here we have the posterior aspect of the spinal cord with the veins that are running along the spinal cord. As you know, was Albert Adamkiewicz from Poland. He described the artery of Adamkiewicz in the 18 years last century. Adamkiewicz injected arteries and veins of the spinal cord with a special method of attachment mass. He used to inject color red for arteries and color blue for veins. This is an original picture. Can you see the arrow?
Yes, we can.
Okay. He used to draw these drawings. These are the original drawings. Now, with special techniques, we can inject the brain arteries and also the spinal arteries. The anterior spinal artery is coming from the vertebral arteries here. We have the left vertebral artery, and in the opposite side, the hypoplastic vertebral artery, the right side. Here we can see also the lower cranial nerves, and also the small, very small anterior spinal artery coming from both sides, the left and the right vertebral arteries. This is the anterior spinal artery. So the artery of Adamkiewicz traveled with the ventral root to the ventral surface of the spinal cord, and it took a characteristic hairpin, which turned caudally. This is the anterior spinal artery, the Adamkiewicz artery. This has the appearance of hairpin. The irrigation of the spinal cord is dependent on the artery of Adamkiewicz and branches of the vertebral arteries. This artery is of enormous clinical, surgical, and radiological importance. Here we have a posterior aspect of the superior spinal cord. Here we can see the upper part of the spinal cord with the posterior spinal arteries coming from the vertebral arteries. And these are the first posterior posterior spinal nerves. One. Here we have the artery of Adamkiewicz. Which is the importance of this artery? Well, the preoperative localization of this artery is very important in the surgical transthoracic spinal procedures. The anatomical knowledge gained preoperatively may reduce the risk of postoperative paraplegia. These are some features of this Adamkiewicz artery. In 40 spinal cords, the origin of this Adamkiewicz artery was from T3. It was the highest level of this artery. This is the origin of the Adamkiewicz artery. As you can see, this is the upper part of the spinal cord. So we have the first, the second, number 3, 4, 5, 6, 7, and 8 cranial nerves. And then in the T3, we have the highest levels of the origin of this artery of Adamkiewicz. In this picture below, we can see the complete spinal cord in the thoracic and lumbosacral segment. Here we have the highest level of the arising from Adamkiewicz artery. The anterior roots of the spinal nerves and the Adamkiewicz artery. Here we have the dentate ligaments and some arachnoid membrane. The lowest level of the Adamkiewicz artery was in the left side in L2, lumbar 2 spinal root, anterior spinal root. Here, this is the L2, lumbar 2 in the left side. This is a very beautiful artery coming from left L2. If we mobilize these anterior spinal nerves, we can see the Adamkiewicz artery, and in this side, we are seeing the posterior spinal artery coming from the end of this Adamkiewicz artery. This drawing was obtained from an original article by Adamkiewicz, published in 1881 and 1882, showing arterial vasculature of the spinal cord and the bidirectional flow of blood in spinal cord vasculature. Now with modern techniques to inject these arteries and veins, we can see this kind of pictures. They are really beautiful. The great anterior radiculomedullary artery. All the 40 spinal cords had Adamkiewicz artery. 36 have a great anterior radiculomedullary artery from left side. 11 from left T1 and 8 from left T8. The average diameter of the artery of Adamkiewicz at the spinal cord was 0.81 millimeters, range 0.6 to 1.11 millimeters. In four spinal cords, John Bennett, there is too much noise.
Yeah, does anybody, could everybody mute, please? Mute your screens, the panel. Let me maybe make sure I mute people. Okay, okay, mute. You need to mute, Mogi. Could you please mute your screen, please?
Okay. It's
okay.
Much better.
That's better, okay.
It's okay. In four spinal cords, the great anterior radiculomedullary artery was in the right side. So, but two of these spinal cords, this artery was double, as you can see in this picture. But only in 4 spinal cords, the Adamkiewicz artery was in the right side. In the 36, was in the left side. This is very important to know. Here we have another anterior Adamkiewicz artery with a small artery coming from this lumbar nerve roots. Okay, Adamkiewicz artery. This is another Adamkiewicz artery from left side and also from the right side. These are two Adamkiewicz arteries. One of coming from each side. This is another picture of this vascular anatomy of the spinal cord. The thoracic arteries. This artery was present in 38 spinal cords, 32 in the left side and 6 in the right side. 2 spinal cords did not have thoracic artery. It was most frequent in left T4 in 9 specimens, followed by left T3 in 7 specimens. So most frequent left T4. Thoracic 4 segment. In 10 spinal cords, there were a double thoracic artery. This is the aspect of the thoracic artery. Here we have this thoracic artery coming from right side in this case. And in this case, coming from left side. Remember that this artery is arising mainly from thoracic 3 segment, especially in the left side. This is a very small thoracic artery, but it's possible with my technique to inject this kind of small arteries. The narrowing of the thoracic segment of the anterior spinal artery has an average diameter of 0.33 millimeters, as you can see in this point. The range was 0.17 millimeters to 0.53 millimeters. This measure was done always in these 40 spinal cords at the level of thoracic 5 segment in this part. Here we took that measures. This is the thoracic artery. The great posterior radiculomedullary artery. Have you ever heard about a great posterior radiculomedullary artery? It's not few people knows about this artery, because most of the people think that the most important artery in the thoracolumbar lumbosacral segment of the spinal cord is the Adamkiewicz artery, but that is not true. This great posterior in the posterior aspect of the spinal cord is very, very important. The great posterior radiculomedullary artery was found in 28 spinal cords. This was found in the left side in 19 spinal cords, and in 16 spinal cords was found in the right side. In 7 spinal cords was found in both sides. Look at this. This picture is really, really beautiful, because we are seeing here we have the posterior aspect of the spinal cord. And in the other side, for example, with the arrow in this side, this is coming from the anterior. This is the Adamkiewicz artery. But in these spinal cords, we found this great posterior radiculomedullary artery. In this case, coming from left thoracic 10th level. What is known about this artery? Various authors postulate such a vessel: Gilliland, 1958, Lasortes in 1957, Romanes in 1965, and Jellinger in 1966. But here is the important. Others do not mention it or even deny its existence. For example, Corbin in 1961, Clemens in 1966, and Dingindian in 1970, Domis 1980. According to Jellinger, a large posterior radicular artery is seen caudally in about 75% of instances, but its caliber does not approach that of the large anterior vessels. The diameter of this is about 350 to 500 micras. Its height is more caudal than that of the anterior radicularis magna artery. Here we have this great posterior radiculomedullary artery that is coming from left T9. So I can say that there is no doubt about its existence. There is no doubt about its existence. It exists. In this spinal cord, even when there is a not great posterior radiculomedullary artery, there is a very good anastomotic arc. So look at this. Here we have the anterior spinal artery, the Adamkiewicz artery. And here, look at this segment. Let's go to the next slide to see what happened in the conus medullaris. Look at this. This is the anastomotic arc through the posterior spinal artery. This is the posterior spinal artery. Not the radiculomedullary artery, just the posterior spinal artery coming from the trifurcation of the Adamkiewicz artery at the conus medullaris. In this spinal cord, there was not a great posterior radiculomedullary artery. Instead, there were several radicular arteries. Left view of the anastomotic arc. Most of the arterial supply comes from the right side of the anastomotic arc. This is the posterior aspect of the spinal cord. What's happening with cervical radiculomedullary arteries? There were 24 cervical arteries coming from the right side, 8 from C6 and 8 from C7. There were 11 cervical arteries coming from the left side, 4 from C5 and 3 from C7. Here we have the opposite to the Adamkiewicz artery. In the cervical segment is most important the right side. In 24, we have these arteries coming from right side. In 4 spinal cords, there were 4 cervical arteries. In 5, there were 3 cervical arteries. And in 8 cord spines, there were 2 cervical arteries. Most of the cervical spinal segment have 4 cervical arteries. Here we have the cervical cord arteries. Its average diameter is 0.49 millimeters from 0.21 to 0.73 millimeters. They are very, very small. Sometimes it's very difficult to inject these arteries, but most of the times we can inject these very, very small arteries. In this case, this was the smallest, 0.21 millimeter. The great spinal anterior vein. Let's go to see what's happening with the veins of the spinal cord. In 29 spinal cords, there were a great spinal anterior vein. Average diameter from 0.46 to 1.32. The average diameter, 0.8 millimeters. This is really beautiful to see these arteries and veins of the spinal cord. Look at this. Really, really amazing, really beautiful. I'm going to show you some pictures to see this kind of vessels, very, very small, less than 100 microns. Here we have the posterior aspect of the spinal, lumbosacral spinal segment, the posterior spinal arteries, the veins. In 32 spinal cords, there were a great spinal posterior vein, average diameter 0.86 millimeters, from 0.52 to 1.48 millimeters. This was the biggest vein of the posterior spinal segment. Look at this. This vein is the biggest. this was a conglomerate of veins. At the end of this conference, I'm going to show you some videos about this spinal cord vein. Looks beautiful. The smallest was 0.58 millimeters, this one, and also this one. Vein with some small curves. Some of these veins organized in small curves. These small curves. I'm going to show you some pictures about the organization of the venous system of the spinal cord. Here we have this vein to a nerve root. Some small cords. Okay, I'm going to show you some videos about these fissures. Do you agree?
Yes. Yes, Victor, that'd be great.
Yes.
Okay. Okay, I'm going to show you this this video. Okay, something is not good with this, but let me show you this. Okay. Okay, can you see it?
Yeah.
Look at this. This is really, really impressive. This is the injection of the venous system of the lumbosacral spinal cord. Can you hear me?
Yes.
Yes.
Okay.
Listen.
Look at this. This is really, really impressive. It's really amazing about the organization of the venous flow of this spinal cord. I have been working the injection of brains since 28 years ago, but I began to inject spinal cords about 8 years ago, 8 or 9 years ago. And what I have found is really, really beautiful. I have also the opportunity to take videos and pictures in all of these spinal cords. Until now, I have 150 spinal cords injected. All of them injected in arteries and veins, but I still cannot finish the research because it's heavy to take the data of measures and the arising of every artery and vein of these specimens. Let me show you another beautiful video. So can you see it?
Yes.
Okay. I want to be very sure that you are seeing this kind of injection. This is also beautiful, but do you have some question?
Mojahid, any questions so far? Mojahid, any questions so far? Mojahid?
We have comment from Prof. Derraj.
Thank you very much for this nice and elaborate presentation. And did you notice any change between the various specimens you have examined as regards the distribution of the vessels? And also, we noticed that the arteries here looks smaller than the veins. Any something lying behind that?
Any what? John Bennett, what was the question?
He said the arteries are smaller than the veins. Is that
Yes,
true in
yes.
real life?
Yes, of course. For example, look at this. Here we have the posterior spinal arteries in the posterior aspect of this spinal cord. Look at the size of these very small arteries, very, very small. Probably 100 and 200 micras. And then look the size of the spinal veins, spinal cord veins. They are bigger.
So that's not just cadaver specimens. That's in real life, that's the way it is.
Yes.
Okay.
Yes, of course. Let me show you another one. So look the difference between some spinal cords and others. Look at this. This is really, really nice video because you can see clearly the difference between, look at this. It's really, really beautiful to see this injection. This vein is covered with a very thin arachnoid membrane. This is very, very thin arachnoid membrane. And what's going to happen in this segment? Suddenly, the veins are very, very thin. Suddenly, the wide veins are from here to the conus, but in the thoracic aspect of the spinal cord, they were very, very thin. Let's go to see again.
رجع ثاني.
Suddenly, the veins are very, very thin. So let me show you this one. Look at this. This is the posterior aspect. These are some arachnoid. Some arachnoid. The filum terminal, conus medullaris, filum terminal. I am separating these lumbar nerve roots and some sacral nerve roots. The caudecina, this is caudecina. Excuse me?
Very nice.
This is the last one that I want to show you. I think we are going to have too many time to speak about the anatomy. This is also beautiful.
Nice videos, but is there videos for the arteries?
Yes, I have some videos for arteries, and they are more difficult to obtain good videos, but I'm going to show you some of them, of course.
I hope so. Thank you.
Okay, let me show you. Let me show you some. This is the very small needle, and here we have the posterior spinal radiculomedullary artery. This is not easy to make because look at this. Because of the pressure, we have some artifact here, but look at this. Okay. This is just an example, but let me show you this one. Look at this. This is the Adamkiewicz artery. Look at this.
Nice work.
I want to show you this because suddenly I inject with more force, and look at this. This is a conus medullaris. Look the injection in these small arteries.
Yes, I notice.
Yes.
Good. What is the technique used to dissect these cadavers?
Well, the most important is to make the injections in the fresh specimens. Fresh
Yes.
specimens. Yes. That is the most important thing.
Can you tell us the difference, Victor? What would make a fresh specimen better?
For example, fresh specimen is about 24 to 48 hours from the death of people, of a person. 24 to 48 hours after. But you know, these corpses are frozen. So then after you remove the spinal cord, and after to wash the spinal cord, and also to inject the veins and arteries with some water, and then after to inject them with silicone, with latex.
Excellent. Now
I'm also doing this
model.
These spinal models. These are from plastic, and they are really useful because they are made in scale 1:1. For example, here we have this kind of a specimen of the skull and the cervical vertebrae, and they are really, they are very real. They are not real. They are made from plastic. So this is what I am doing now. I am working with these models in order to understand much better the anatomy of the brain, the skull, and also the spine.
Our university have some cadavers. They dissect them, but the microanatomy of the vasculature of the spinal cord is not so obvious like that you have presented in your videos. This is the most important point that I have noticed. It's a very, you have doing a great work to save these arteries and veins. When they dissect the cadavers in the labs here, They have not saved the veins. Maybe they collapsed.
Yes, that's true, because you have to work them in fresh corpse.
Yes. After that, how do you save these specimens?
With formalin.
Yes.
Formal, 10% formalin.
But
Yes.
they have latex inside, right? They just freezes the latex.
Yeah, the latex. You can get the latex everywhere. It's very easy to get the latex, and also the pigment, red or blue pigment.
Okay.
Yes. Another question, if possible.
It's possible what?
If possible, could I ask further questions?
Sure.
When you pump the ink, maybe the red or the blue, into the arteries or veins, it's pumped manually or by a mechanic pump?
Manually.
Manually.
Yes.
So it's pretty time consuming.
With
Takes a lot of time, right?
Yeah.
When you presented your work, you said that you don't have time to complete the research. Could you please get us more information about your research?
Yes, of course. Yes. Now I am trying to publish the fissures in 50 spinal cords. Most probably this year is going to be published the fissures of the first spinal cords. Yes, of course.
Excellent. Could I involve in your research?
Yes, of course.
I'm so pleased to be your student. I'm working to have some research in the basic sciences.
Yes, of course. Yeah.
I have some experience in medical writing.
The working together is much better than working alone.
I hope that.
Yes.
Could you please send me your mailing address?
Yeah.
Yes, of course.
Excellent.
Dr. John Bennett can give you my email, and also we can get a connection with John Bennett.
Yes, excellent.
Of course.
Yes. Well, we see a great collaboration being born here, live.
Yes.
That's the value of this platform, is the networking and meeting other people. Does anybody have any comments right now for Victor at this point? Abdel Muhid, there's a few people that haven't really talked too much. Wael Abbas, are you still there? Are you there? Okay. Oh, Carlos. Carlos is there. Are you there, Carlos? Or Mogi, whatever. If you have any questions or comments, Mogi, go ahead.
Hello?
Yes, we hear you. Go ahead, Mogi.
We are very thankful for Professor Victor, for this good presentation. So we got benefited very much from it. We do use to operate but we don't see so much as
So I don't understand. The connection is kind of rough. Do you understand the question, Victor?
No, I didn't understand because there was too much.
Yeah, the Wi-Fi. Yeah, the Wi-Fi is not.
Maybe it's.
Well, whoever's asking that question, you can text it in the chat option to the right. There's a chat option that you can write the question, because we're having a hard time understanding.
Yes.
Because of the Wi-Fi connection.
That's what?
Okay.
1 minute. 1 minute.
Yes,
okay.
No problem.
Okay.
Any neurosurgical significance for for this arteries and vein while we are operating in the spinal cord. Mr. Derrak say he used to operate in spinal cord, but he don't need, note a lot of visits like this while he operating on spinal cord. What's the significant and surgical significant behind we can get benefit behind know this visit? This microanatomy.
Well, the anatomics of the spinal cord is very, very important for clinics and also surgeries, because if you know the real vascularization of the spinal cord, if you know that there is not only Adamkiewicz spinal artery, anterior radiculomedullary magnus artery, but also there is a posterior spinal radiculomedullary artery. That is a very nice implication, a very, very valuable significance, because if, for example, if a thoracic surgeon is going to clip the thoracic artery in order to correct an thoracic aneurysm of the aorta, thoracic aneurysm. So if he is going to close the flow of this segment of the aorta, if you have a good posterior radiculomedullary artery, you are not going to have probably an infarct of the spinal cord. But if you don't have a good posterior radiculomedullary artery, you can get an infarct of the spinal cord. So I think there are too many reasons to know the vasculature of the spinal cord.
Okay, thank you. Thank you.
Are these studies are available now for clinical practice? I mean to study the vasculature of the spinal cord before doing any surgery. Is it available for clinical practice?
I think they are more important to thoracic surgery and also for surgery. For example, some tumors, some vascular malformations in the spinal cord, because the spinal cords that I have been studying have so many variations. So it's possible that you can be confused with some of them.
He asked, do you publish papers or you have books with this?
In this, at the end of this year, we are going to publish a book about the vascular anatomy of the brain and also the spinal cord. I published one book 20 years ago. 20 years ago, I published a book in Spanish language about the variations of the arteries of the brain. But now, at the end of this year, we are going to have a book in English about the irrigation of the brain and also the spinal cord. At the end of this year, I hope. Once we have the book, of course, we are going to give you this book.
Thank you. That's very interesting. Thank you.
Victor, could you mention the conferences that you've spoken at? Like I said initially at the start of the program, neuroanatomy is a lifelong education for a neurosurgeon. They constantly study it, even when they're been in practice for years. And I was impressed with that. Could you tell us about a few of the conferences you've been at?
Okay, I have been working in several countries. I did a school-based fellow in the United States about 22 years ago, 21, 22 years ago. So I have been giving conferences in Boston, Massachusetts, in Kathmandu, Nepal, Pakistan, Karachi, in Dubai. And this month, I hope to be at the end of this month in China, and in 3 months more in Praga. I have been working with the surgical anatomy because I think this is a very useful knowledge that you, as a brain or spinal surgeon, you need to know the specific vascular anatomy. So that's the reason I am working with these techniques.
Okay. Yeah, you're going to China to go to Juha Hernesniemi's conference.
With Juha Hernesniemi conferences in from 25 of May this month.
Yeah, we are going to televise that, Moshe, on this channel.
Yes.
The conference from China.
Yes, I know.
Okay.
Okay. Victor, I don't know if you alluded to it during your talk, but could you describe essentially the technique for latex injection, what it takes, you know, the procedure involved?
Yes, we can have, we should have another conference in order to show you how to get a good latex to inject. No problem, of course.
Okay. Very good. Any more comments or questions? There's the medical student, Hussam, the nascent neuroanatomist. Any comments or questions for Victor before we close?
No, thanks so much. But don't miss to send me your mail.
Yeah, I will. We will. We'll get you in contact with Victor.
Yes. How can I write the? Is Victor?
Well, you know, there's a chat feature to the right, Victor.
Okay.
You see that chat right there, and you can give it to everybody actually.
Okay.
You see where it is, right?
Yes.
Yeah, just type it in there, and you see it, Hussam, right? On the right there's a chat feature. How many neurosurgeons are there in Sudan that are watching?
We have here in this room, we have 4 neurosurgeons, but as you can see that there are some other neurosurgeons who are joining us online from other places.
Oh, can we meet them on camera? Can we meet them on camera? They don't want to do that.
You see
hello, Amani. How are you doing, Amani?
In Sudan, Saudi Arabia. Yeah.
Hi, Dr. Amani.
Oh, okay, Amani is one of them. Hi, how are you? Amani, are you a neurosurgical resident?
No, I'm a certified neurosurgeon. I already finished yeah. Okay. Hi, Dr. Darraj.
Hi, how are you?
Hi, Dr. Amani.
Hi, Hunaida, say hi for you, Dr. Amani.
Yeah, we want to see the crowd there. We got a good following there in Sudan.
Yeah, I have so many friends back in Sudan.
Nice to meet you all.
Yeah.
And you can see also Dr. Abdel Majid from Saudi Arabia.
Hi, Abdel Majid.
Yes, Abdel Majid.
Raise your hand.
Yeah, I didn't.
And also I have seen a few minutes ago Dr. Sadiq. I don't know whether he's in Saudi Arabia or in Sudan now.
And
And Wael Abbas also. I don't know whether in Sudan or in Saudi Arabia.
This is
How are you? And
I'm
we
from
also
Saudi Arabia.
Yeah.
oh, assalamu alaikum.
This one. This one,
It's
Tawassul Jarmat from China.
Where
Tawassul, she is now in China, Tawassul Jarmat.
Yeah,
There are
me
so
and the
many
mom.
people that are catching this meeting.
And here we have Dr. Wael Abbas, Amani.
are you at someone's house now, or are you at the hospital?
Yeah,
No.
Yeah, hospital, yes.
I just came back from hospital, just coming now. So
Oh,
I
okay.
came back.
Okay, very good.
Yeah.
Yeah, we hope to
Yeah.
see you. Tuesday we have a talk, right, Mogi?
Yeah, I think so. I will travel to Tanzania maybe on Tuesday. So I will not coordinate the next
Okay.
Tuesday, but I will let you know.
Yeah,
who
okay.
is
Let me know when you're ready to. Yeah, let me know when you're ready to broadcast. And you're all welcome to participate in
Again,
any of our broadcasts. Okay.
Bye.
Okay, thank you very much. And good night, everyone. Good day, Victor. Thank you very much for everything.
Thank you very much.
Bye-bye.
Bye.
Bye,
Have a
Hassan.
nice night.
Good night.
Good night. Good night.
Bye-bye.
Thank you. Thank you,
welcome.
Victor.
You're welcome. Good
Thank
night.
you.
Thank you to